All right, back with the WMAY morning news feed, and let's talk schools reacting to COVID-19. I'm Greg Bishop. Thanks for taking time with us each and every weekday morning and allowing me to help kind of break down some of the things that are happening and impacting you as taxpayers, as parents, and so on. So we've got, of course, increased COVID-19 cases. It's raising some alarm for a lot of people. And you've also got what's reported as increased COVID-19 hospitalizations. And I really think that, as I've been saying for quite some time, as somebody who looks at the headlines a lot and reads all kinds of news sources and looks at the raw data myself, I feel I need more context for a lot of these reports that are coming out. In particular, we talked briefly yesterday about how there's a discussion of increased pediatric cases, pediatric cases rather, of kids getting COVID and being hospitalized with COVID. And you've really got to dig into those numbers and better understand, are these kids that are in the hospital for some kind of non-COVID related issue like a tonsillectomy or a broken bone, and they just happen to test positive for COVID? Is that the same thing that could be translated to the increased COVID hospitalizations that we're told about? Are people in the hospital for something else, but they just so happen to test positive for COVID? So we really do need some of that context to better understand where we're at right now in this virus, especially now as we're approaching a full 2 years that it's been impacting the United States, let alone here in central Illinois. So one of the areas that was impacted early on, of course, not just businesses with the stay-home order, but schools with being told by the governor that they couldn't have in-person education back in April of 2020. And you remember that was something that a lot of angst, a lot of anxiety over, kids having to learn remotely, teachers having to teach remotely and manage all of that, and parents having to find childcare because some of them were essential workers and had to go to work. So the schools issue has been one that has been building a lot of anxiety in people. And when you see some of the most reporting about COVID-19 numbers, you can see why there's conversations about what's going to happen next. Well, up in Chicago Public Schools were back in on Monday, and there were some other districts that were thinking around the state we're going to go remote. Some have said that they had staffing issues with staff that were out with COVID, so they couldn't come back in full in person. So it's different all across the state of what's happening. But yesterday, you had the Chicago Teachers Union essentially putting a vote out for teachers to say whether or not they wanted to go remote because of increased COVID-19 cases. And the Chicago Department of Public Health and the Chicago Public Schools, they responded yesterday saying if the vote is approved by the teachers union, they're going to have to cancel class for today. Well, the vote came in, and I think it was more than 70% of the teachers union in Chicago voted to go remote. So essentially, it's kind of like a work stoppage. They're not going into school. The schools will be open today in Chicago, I believe, but there's not going to be any in-person instruction. And Chicago Public Schools, they did take the opportunity to say that, they're going to have to retool and see what happens now moving forward here. But one thing that was interesting yesterday was the Chicago Public Health Department Commissioner, Dr. Allison Arwady. She had, some reaction just to this idea of not going to class for in-person learning, and I wanted to share this clip with you. It's a minute long. Dr. Arwady talking about how, the damage done to the child from remote learning we still haven't come back from, how we've got to look at all of these numbers in better context. We've got to better understand the overall health of people, and then she makes a statement at the end I think will have a lot of interest for people. So here's Dr. Allison Arwady yesterday during a news conference.
Not yet recovered from the negative effects that we saw from so many kids trying to learn remotely. And it's my job to think about health broadly. And health broadly, especially for kids, yeah, it's protecting from COVID, but are they in settings that protect their physical health, promote their mental health, make sure that they are emotionally developing in the way that they need to, that they're having the social interactions? And it is, people around the country they just say to me, like, what is going on in Chicago? Our schools are all demanding that we should take the masks off, and you're not wanting to come back. And again, I understand that people are scared. I understand that you're looking at those numbers and seeing that they're high. But I want to just reassure you that, especially if you're vaccinated, your child is vaccinated, this is behaving really like the flu, and we don't close school districts, especially for extended periods of time, for the flu.
So again, that's Allison Arwady, the commissioner for the Chicago Department of Public Health, saying that we don't close the school down for a flu. And if you're vaccinated and your kids are vaccinated, COVID-19 right now is really behaving like the flu, she says. So I'd love to hear your thoughts on this. 217-629-7970. Also coming up, we'll hear from the Springfield School Superintendent, Jennifer Gill, about what the direction is for Springfield Public Schools, because they don't come back until the 10th. And as it stands right now, they're coming back to in-person, so we'll see what happens there. 217-629-7970. Good morning. You are on WMAY. What's going on?
Good morning.
Hey.
I heard a new law that's passing in Ohio, and I think it would be amazing to do it in every single city that wants to go remote. What they're doing is, whatever it costs for a kid to go to school, they're trying to pass where the parents can take that money, say it's $2,000. They can take that $2,000 from the state or from the city, put it towards their payment for a Catholic or a not necessarily Catholic, but a private school.
Yeah, there's a couple of different ways that can be done. One is through like a voucher type of program where, you know, the parents can get a voucher because they pay taxes, right? And the taxes go to public schools, but they can get a voucher to essentially take those tax dollars and put them towards a school of their choice. What you're talking about is school choice here. And there's also the idea of just allowing the money to follow the child. So wherever the child wants to go, be it a parochial school, a non-public school, a charter school, the dollars would chase the child or follow the child. Now, there's a lot of debate about this. Schools don't, especially public schools and teachers' unions in those public schools, they don't like that idea because it could mean fewer dollars going to those public schools, which could diminish the efficacy of those public schools.
Then step up to the plate. Wear your mask, like everybody tells you it works. Wear your mask. Go to school. Get these kids in school.
Well, and what I think is interesting, I'm glad you brought up the idea of school choice. One thing that's left out of this conversation about talking about Chicago public schools or about Springfield public schools is, what are the non-public schools doing? What are the parochial schools doing? And what I've seen from the past year and a half now of watching all of this closely is the non-public schools are going to school in person. And there are some non-public schools that aren't requiring kids to wear masks. So we'll have to follow up and see what some of the charter schools, non-public schools, parochial schools are doing all across the state. But one thing that we did see when we went full remote in 2020 was an influx of students heading towards non-public schools because they were being taught in person. So speaking of public schools, though, last night, Superintendent Jennifer Gill, the Springfield School Board, at a special school board meeting, she raised some issues that might not be what some of the teachers' unions were looking for, and bringing about what is now termed as an adaptive pause.
A lot of conversation about adaptive pause. And I just wanted to explain a little bit about adaptive pause, because it's a new vocabulary term, a phrase that we have never used in the history of school. But an adaptive pause, as stated by not only the Illinois Department of Public Health, but also the Illinois State Board of Education, provides for a temporary stop in in-person learning when recommended by the local health department to mitigate the spread of a disease or COVID-19 in this case, based on specific school data. So we're a large district with 33 different schools. A smaller district down the road might have one school where they have a high school, a middle school, and an elementary all in one building. That's different than what we have here. That might even be smaller than some of our elementary schools individually. So we have a big area of a community that we serve, and 33 individual school sites that all operate fairly separate throughout the school day. So during an adaptive pause, as per Illinois State Board of Education, we must provide remote learning. So if we take a day off and we have it be a non-student attendance day, and we don't do remote learning, then we have to make that up. So there is no way of just saying we're going to take off school and not make that up.
And she ultimately said that that's going to impact the calendar and could impact seniors looking to graduate if they go into an adaptive pause. Now, again, I think the most important part there is it has to be in conjunction with the local health department. And we've had a school in Sangamon County actually go to an adaptive pause. That was the Tri-City Schools several weeks ago, and the Sangamon County Department of Public Health said they looked at the numbers for that particular school district, not the size of Springfield District 186, but still a full district. And they did do an adaptive pause with the Sangamon County Department of Public Health, essentially reviewing the numbers and giving the green light for that. So ultimately, though, the decision was they're not going to go into an adaptive pause for Springfield District 186, but I imagine that's not going to be the last of that conversation. We may revisit this a little bit later on the WMAY morning news feed to get your reaction to more about whether or not schools should go into an adaptive pause. It's